Lisa Broda's annual report is called Desperately Waiting, as in young people in Saskatchewan are desperately waiting for help. Long wait times for mental health and addiction services has been a problem in the province for some time. But from social isolation to school closures, the Children's Advocate says COVID-19 has made things worse.
We recognize the pressures of responding to the pandemic have hindered the pace of government efforts on addressing mental health. However, the impacts of the pandemic should signal the increased urgency required to address barriers to meaningful services that were already an issue prior to the pandemic.
The report involved almost 500 participants from across Saskatchewan. It investigated concerns around self-harm, suicide, and substance abuse among young people. And a key finding: nearly 40% of surveyed children and youth say they felt a decline in their mental health as a result of the pandemic.
As a first world country, children should not have to wait for services due to not having enough. The most common statement we heard was there's never enough, meaning not enough psychologists, psychiatrists, mental health or addiction counselors, elders, community resources.
Wanda Ball knows the impact of that all too well. The Saskatchewan mother lost her 16-year-old son Kai to suicide 5 years ago.
So we are constantly kind of fighting back and forth to get him the care he needed, and obviously it fell through.
If young people don't get the help they need in time, the report says, it can lead them to an emergency room or worse. To avoid this, the Children's Advocate gave the province 14 recommendations. Among them, funding more mental health counselors and Indigenous elders in schools, and reevaluating what youth addictions treatment looks like in Saskatchewan. Everett Hindley, the Minister of Mental Health and Addiction, says the province is taking this all under consideration.
We are going to continue to have some conversations and discussions with our partners and fellow ministries and try to address this as quickly as possible. Identify, how we can best approach this to make some meaningful change.
The Children's Advocate says now is the time for the province to step up its mental health and addiction services. That way, Broda says, children can transition into adulthood and get the opportunities they deserve. Laura Sharpaletti, CBC News, Regina.